Welcome to Joe's Healthcare Journey. I will be speaking while you are reading. If you find it distracting, turn down the volume. I won't be offended. Through his association, union, or employer, Joe has a personal healthcare concierge, a healthcare coach, a physician's assistant available to him 24/7, 365. Engagement with each individual covered under a healthcare plan is the same but different. Everyone in the group will receive an announcement of the new benefit available to them, an artificial intelligence-based healthcare concierge. All will receive an invitation to opt in and create their own personal healthcare record and the benefits of having one. In the event you end up in an emergency room as a patient or with a loved one, how important is it to be able to provide the attending ER physician with a complete and up-to-date medical record? What drugs are prescribed, what conditions they are for, and who the physicians are, complete with prescription and contact details. At a time of crisis, all the information necessary for the attending to treat the patient is instantly available on your phone through your own personal health concierge. Your health concierge is proactive. In some instances, Joe's vitals could be monitored and exchanged with his physician when they are in a clinically relevant zone. All communications between Joe's healthcare concierge, his doctor, and caregiver are fully HIPAA compliant. They are confidential and voluntary. An example of proactive monitoring is A1C for a diabetic. Most diabetics monitor their A1C. When a virtual care coach, a virtual physician's assistant, is also watching, they can notify Joe's real physician when warranted by A1C levels. This digital transaction prompts human intervention, most likely a phone call from a physician's assistant or a nurse. This human interaction, this human intervention will result in a change of Joe's care plan to keep his diabetes under control. As a result, Joe avoids a negative health event. It could be not feeling well, a bad day, or it could be a trip to the emergency room. The critical point is Joe maintains a healthier life. Joe feels better. Joe lives a fuller, richer, healthier life. At the same time, Joe's healthcare cost is reduced. What could be a better result of the healthcare concierge than a healthier Joe that spends less time receiving costly medical care and more time a productive person living a healthier life? Currently, there are more than 40 different versions of chronic care support available, and each was designed to solve medically mission-critical clinical care issues. To be explicitly clear, these programs are designed to solve clinical care issues, to improve patient outcomes. They are not and were not designed to save the healthcare money. It is serendipitous that when an insured population is healthier, they are less expensive to insure and care for. The 360 quadrant solution is based on two cornerstone elements. The first is healthier people are happier, more productive, and cost less to insure. The second is outpatient healthcare costs must be controlled with no loss. Let me repeat that, with no loss in quality of care. 360 deploys an easy-to-use, in-network outpatient care cost control program. We implement our AI-driven personal healthcare concierge. We support the desired behaviors with video education designed for each specific group. Last and certainly not least, we treat healthcare cost expense like every other corporate budget item and measure KPIs monthly. Based on the KPIs, based on those key performance indicators, our granular, actionable data. We adjust our initiatives on a monthly basis with you as a plan sponsor and your key stakeholders for your group's healthcare plan to gain the desired result. Thank you for your interest in Smarter Care.